Activities like walking, running, and climbing stairs require the thigh to extend back behind the body. And under normal circumstances, the majority of this motion should occur from the hip joint itself. And it should be seen as just a small rotation from the hip. And there really should be very little contribution of the lower back and the pelvis to this motion. However, if the hip flexor muscle group or any of the soft tissues on the anterior aspect of the hip joint become tight, it will actually block this normal hip extension motion. And in order to compensate for that, the body needs to move through a different path in order to extend extend the thigh behind the body. And the most common pattern that we see is, instead of an extension from the hip joint, is we get an extension or a movement from the lower back itself. So as you can see, if I'm extending from the lower back, it creates a similar position of the thigh behind the body. But as we're moving from the back instead of the hip, it puts a considerable amount of bending stress and compression force on the lower back itself. And this can lead to problems with the back and the pelvis. So for this reason, it is important that we build and maintain proper flexibility of the hip flexor muscle group. This can normally be done through stretching, but the problem is almost everybody stretches the hip flexors in an inefficient and an improper way. So let's take a look at the best way to stretch this hip flexor muscle group to make sure we actually build mobility at the hip joint and we spare the back and the pelvis during the stretch. In order to stretch the hip flexor muscle groups, we need to get the thigh to extend back behind the body. And this is generally done with some type of lunge position. Now, normally when we stretch this, what we want to do is focus the motion at the hip joint itself. The problem is that if the hip flexors are tight, there'll be a tendency for the pelvis to rotate forward into an anterior tilt position, and in conjunction with this, we'll get the lower back to extend. And if we're not conscious about preventing this pattern, what we're actually going to do is replicate this poor pattern during the stretch. So in order to stretch properly, what we're going to do is we're going to stabilize the pelvis and the lower back by performing a posterior pelvic tilt while we hold the stretch. So to do this, I'm simply going to roll my hips forward such that I'm tucking my tailbone underneath my trunk. And as we do this, we'll just use my belt line here as an example or a reference point for our pelvic position. And as we perform that pelvic tilt, we create a little bit of a more level position of the pelvis. And if I hold this pelvic tilt position while I extend my thigh back, it'll hold the pelvis level and stable, and I'll focus that extension of the thigh at the hip joint itself. In contrast, if I don't perform that pelvic tilt during this motion, what I'm going to get is an anterior tilt or inclination of my pelvis, which again, we can use my belt line as the reference here. So you'll note the difference in position between here, where I don't perform a pelvic tilt, versus here, when I do perform a pelvic tilt. And it's really important that we hold this pelvis level and stable by performing this pelvic tilt in that posterior direction while we do this. Now, I'm using a standing lunge stretch as an example, but the same principle can be applied to a standing lunge, a kneeling lunge, or some type of lunge position, using a stair or a chair in order to aid in that hip extension.